Many government things like luxury and glamorous things prove they are a good governor and prove they care about their citizen. But what real government should do is to know which is needed for the citizen, which is effective and which is not. We have seen so many things that the government does that are not aligned with what the citizen need. The logic is similar. If you just focus on healthcare quality rather than accessibility, people in need are dying to get healthcare, even less unfortunate people. Accessibility needs to be championed, proud to stand in proposition. Few points of framing before any of my arguments. Firstly, let's frame developing countries. Four things I want to point out is first, lack of money, second, problem with accessibility in various aspects, third, overpopulation, and fourth, low econ situation. This means that developing countries should focus on things that are most urgent at the moment because the limited resources that they have. Secondly, let's take the simplest example of our country, Indonesia. BPJS exists in the current status quo. The problem that exists right now in the current status quo is how BPJS, our main healthcare insurance from the government, is lacking so many things and becomes problematic. The main concern from the society is how long the queue in hospital is, patient getting rejected, and medical bills are not being covered. Well, if you can see, this may seem like a problem of quality, but deep down, it is not. All of this is about patients not getting treatment they should have got. These prove that the government is not trying to make healthcare treatment accessible enough for all people. So the main clash in this debate becomes which side can solve the problem of healthcare sector and developing countries. Two questions I'll answer. First, why doesn't quality solve the current problems? And second, why then accessibility will solve it? First question then, why doesn't quality solve the current problems? The current problems are reflections of overload patient in hospital. A, not enough workers to help in hospital. B, limited hospital for people. And then C, problems with people from low economic family that can barely afford these things. And even if they can get the hold of BPGS, it's not going to be easy for them to get any checkup or treatment. These things will be solved if we just give more knowledge to workers or even upgrade to a new machine. Even if you give more knowledge, their capacity to work remains the same. Even if you upgrade to a new machine, it is still not accessible for all people. Exactly, the problem stays there on your opposition side. And then seeing from the perspective of workers, two things. A, they're exploited to work so many hours per day, exhaustion happens. But B, these workers are overworked, meaning their capability and quality are also lesser. So here's the outcome. The problem and the solution is a mismatch. Like I've told you, it is not about quality. It's about the government not giving accessibility for all its people. If we just continue with giving more knowledge to workers and buying new upgraded machine, it may help a little, but the current problems are not solved. It remains the same. It is within the government of developing countries to know which is to prioritize. And we say we need to prioritize in solving the problems, which leads to the solution of accessibility. Second question then, what in accessibility will solve this? What will happen on the art side of the house? Three things. A, decentralized hospital. When hospital governance allows decision making at local level, meaning it will be more suitable for communities within those areas and fulfilling what is most needed for the people there. Knowing we have limited resources and many demands, we need to make everything suitable. But B, distribution of patient. With opening more hospital, meaning one hospital won't be overpopulated. Those patients can be transferred elsewhere. And this also means that patients do not have to wait in hours, even days, queuing for a spot to get treatment and check up. But C, no exploit workers. This also reduces the amount of overworked workers in hospital that leads to more efficient working workers, meaning better quality of workers also. Additional things you need to understand is about people in rural areas and poor people. These group of people are most vulnerable. They're in need the most, and yet these are the people that are most likely won't get help because you don't have enough reachable hospital near them. Seeing they live in rural areas and low-income families means no facilities for them, lack of security, and also lack of quality of living, which make them more likely to have health problems. So additional hospital and additional subsidies will solve all these problems. So then these leads to us solving all the current problems from the status quo proud to propose.